And President Biden is making history today, announcing a list of 10 prescription drugs that are selected for the Medicare drug price negotiation program. It's the first ever of its kind, and it means that Medicare is now allowed to negotiate with drug companies about the pricing for some of its most expensive drugs used to treat diabetes, blood clots, and even strokes. We're expecting President Biden to deliver remarks on this historic move live. We will bring that to you right there from the White House as soon as he steps up to the mic. In the meantime, our ABC News senior White House correspondent and new White House correspondent Selina Wang joining us now to break it all down, along with senior national policy correspondent Flaherty. Selina, welcome. Let's take it to you first. The Biden administration says they've finally accomplished something Washington has been trying to do for decades, and that's lowering these prescription drug prices. Let's just talk about what it means for Americans and what Americans in particular.
Thank you. It's great to be with you on the program. Now, this is a major milestone for the Biden administration. As you say, this is about giving Americans more affordable drug prices. It's about giving them a fairer price. Americans pay more than citizens of any other country for their medical care. And this program means that for the very first time, Medicare can directly negotiate for lower prices with these drug makers. This is for 10 specific drugs that are used by millions of Americans. Now, according to government data, this negotiation program is estimated to save the government more than $98.5 billion over a decade. Now, during the press briefing earlier, I pressed the White House's top senior domestic policy advisor on how much of those savings would actually get passed on to American citizens. She would not provide any specifics, no estimates, no percentages, but said that it would lower these out-of-pocket costs. And those 10 drugs, they are expensive. According to government data, Americans enrolled in Medicare paid $3.4 billion in out-of-pocket drugs for those out-of-pocket costs for those 10 drugs in 2022. But a really critical point to emphasize here is that these price decreases will not go into effect until 2026. So the question is, how is Biden going to campaign around this, considering the fact that Americans won't feel these effects until after the presidential election?
So, let's just talk about the drugs specifically that are included in this program. I'm looking at the long list right here, and how soon it could go into effect.
Well, you know, as we mentioned, it was not until 2026, and this is a long list of drugs that are widely used by seniors. So we've got Eliquis, which treats strokes and blood clots, Enbrel, which treats arthritis. The list goes on. Blood cancer treatments. These are popular drugs among many seniors in the Medicare program. But I will say that the administration didn't pick them necessarily because they were the most expensive. They picked them on a number of factors, including that they had been on the market. It's been at least 7 years since any of these have been approved. So there is no generic equivalent. They wanted to be able to say to these drug makers, you know, look, these are widely used drugs. Medicare has big negotiating power. We're not going to pay more than what we think is fair. They also point to other countries that often pay significantly less than the United States for these drugs. So the hope here, Kira, is that this is just a start. We start with 10 drugs, it goes to 20, then they keep adding as the years go by. I think what most people need to know at home is they're not necessarily going to see the savings in their pockets anytime soon, not even in 2026. All of that remains to be seen about how these negotiations play out. But then the other issue is that I would be looking at 2025. There's another provision that we're not even talking about that goes into effect that caps the amount seniors have to pay at $2,000 a year. That's actually going to be a potentially bigger savings. So I would be looking at that. But the long run, this will help eventually. It's just going to take some time.
So, are drug makers at all concerned about this historic move? And let's just talk about the implications here.
So they have fought this tooth and nail. They are going to the courts to say this is unconstitutional. This should not be happening. I think what they're up against, though, is public opinion. A lot of Americans want to see the drug prices reined in, and they want to see this happen. So that will play out in the courts. We're watching that. That could factor into a role. How the administration negotiates could factor into what the ultimate price that people have to pay. But, you know, make no mistake, there is significant public support for this program right now.
So, Selina, just to follow up on that, the administration's already facing 8 lawsuits over this move. So what's the philosophy here that this is worth it?
Well, this was asked during the press briefing earlier, and the administration basically said we are confident that the courts will uphold this and that this price negotiation program will go through. But as you heard from Ann, these pharma companies, they are fighting this tooth and nail. They've been gearing up for this for months. They argue that this is not something the government should be dictating. They shouldn't be agreeing. They shouldn't be forced to agree to a government-dictated price. We're also hearing Republican lawmakers blast this move as well. But it's clear that this is something that is important to voters on both sides of the aisle. It's an important moment for President Biden, who campaigned on lowering these drug prices, for taking on big pharma. The question really is, how is this going to play out in the courts, and how is President Biden going to message around this, since, again, these price effects will not come to fruition until 2026.
All right, and we are still waiting for the president to sit up to the podium there. We will take him live as soon as he begins. Selina, Ann, thank you so much. I know I'll still have you both with me to guide us through that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.